Alright, hello. Creating a video to demonstrate proper way to take blood pressure. Learned this in my cancer prevention lab. Got my lovely dad here to help me demonstrate.
Hello.
Proper equipment that you're going to need to perform this skill. You obviously need a blood pressure cuff, which we have here. It's not the proper one you would do if you were taking it. It's for a electronic one, but it's what we have. Normally,
for demonstration purposes.
Yeah. Normally you'd have one that has a pump on it with a gauge so you can see like when you're actually measuring, it's gonna have the reading on there. Also you need a stethoscope so that way you're gonna be able to listen to the heartbeat while you're taking the blood pressure. So proper setup, and like for me and my patient, normally I'd be facing them while they're sitting. They have their arm resting completely flat on a table, completely relaxed. You want them as like calm as possible, just kind of letting it lay there, not tensing up or anything, just letting it go. Then you're gonna be facing them. You'll have them relaxed. You'll, with their arm like straight like that, you'll place your stethoscope on the crook of their elbow here, where you can find that brachial artery. Kind of just find that pulse in there. You'll take the pump and you'll squeeze it up to about 200 pressure-wise, and then you'll slowly let the air out while listening with your stethoscope to the heartbeat. As soon as you hear that first heartbeat, take note of what the reading is on the monitor or on the gauge. That first reading is your systolic reading. It's going to be the top number of your blood pressure. And then just keep listening. You'll continue to hear the heartbeat through your stethoscope as you let air out. When that last heartbeat stops, that's your diastolic reading. So then you can go ahead and let the air out. You've taken your blood pressure. You got the two readings. Systolic is what when the ventricle initially contracts and gets that first pump of blood through the body. The diastolic is when your so like the residual pressure left in your heart after that, kind of like the right after the major contraction. It's kind of important to be able to take blood pressure because it's a really vital part of your body. Needing to know it's one of the main things you're going to do, especially if you're a PA or something like that, or even like for me going into PT, any of my patients, especially if I'm working an outpatient, if they're geriatric, there might be someone who suffers from low blood pressure, high blood pressure, and before I do my activities with them, I might want to just monitor it to see where they're at for the day. So I need to know if I need to kind of take things slower, make sure kind of getting their blood pressure back down rather than like pushing it for the day and trying to see where they can get. So that's basically all you have to do for blood pressure. Thanks for being my model dad. So yeah, hopefully you liked the video.